Welcome to the December 1st, 2020 Select Board meeting. Just got to go through some preliminary things. As a preliminary matter, my name is Peter Carlson. I'll be chairing the Select Board meeting this evening. Please permit me to confirm that all members and persons anticipated on this agenda are present and can hear me. Members, when I please call your name, please respond in the affirmative. Doreen DeFazio.
DeFazio present.
Mr. Often.
Often is here.
Ms. Roy.
Roy here.
Mr. Prisby.
Here.
And Mr. Terenzini.
Present.
Thank you. For members anticipated to be on the agenda for public hearing, I have Mr. Newhouse.
Here.
Thank you. And this evening we have members from the Board of Health and the Health Alliance for a COVID update. I have Mr. Finn.
Here.
The Magnet.
Magnet is here.
Mr. Mueller. Dr. Hirsch. Ms. Clark. All right. In addition, I have Mr. DeShanes.
Shane here.
Thank you. And Mr. Villatoro.
Here.
Mr. Spinney. Okay. Good evening. This open meeting of the Town of Grafton Select Board is being conducted remotely consistent with Governor Baker's executive order of March 12, 2020 due to the current state of the emergency in the Commonwealth due to the outbreak of the COVID-19 virus. In order to mitigate the transmission of the COVID-19 virus, we have been advised and directed by the Commonwealth to suspend all public gatherings, and as such, the Governor's order suspends the requirement of open meeting law to have all meetings at a publicly accessible physical location. Further, all members of public bodies are allowed and encouraged to participate remotely. The order, which you can find posted in the town's website at www.graftonma.gov, allows public bodies to meet entirely remotely so long as reasonable public access is afforded so that the public can follow along with the deliberations of the meeting. Ensuring public access does not ensure public participation unless such participation is required by law. This meeting tonight will feature public comment as we do have a public hearing on the schedule. For this meeting, the Select Board is convened via Zoom conference as posted on the town's website identifying how public may join. Please note that this meeting is being recorded and that some attendees are participating by video conference. Please be aware that other folks may be able to see you and that take care not to screen share your computer. Anything that you broadcast may be captured by the recording. All supportive materials have been provided to this members of this body are available on the town's website, and when final minutes are posted unless otherwise noted. The public is encouraged to follow along using the posted agenda unless I, the chair, note otherwise. Just some basic ground rules before we turn to the first item of the agenda. I just would like to introduce each speaker in the agenda. After they conclude their remarks, the chair will go down the line, inviting each member to provide any comment, questions, or motions. Please hold until your name is called. Further, please remember to mute your phone or computer when you're not speaking, and please speak clearly in a way that helps generate accurate minutes. Please wait for me to yield the floor to you before stating your name and speaking. And if members wish to engage, please do so through me to identify yourself. Please note that each vote this evening will be taken via conducted by roll call vote. All right. First up tonight, we have a couple of announcements. First of all, I want to welcome everyone back I hope everyone had a great holiday break. We don't have a COVID update since we have the Board of Health and the Health Alliance will be present tonight, so we will take that up in a few minutes. Senior Center news. The Senior Center is not having a holiday giving tree this year. Instead, they are accepting gift cards to local businesses to be given to the seniors in our community. A locking Senior Center mailbox has been mounted near the front door of the Senior Center where gift cards can be dropped off. In addition, Unibank's annual holiday giving campaign has gone virtual. Help make the season brighter for seniors in the Grafton community by donating to Grafton Senior Center through Unibank's secure payment collection system, Unipay. We would like to thank everyone who's given to these campaigns. Recreation Department will be hosting Grafton Celebrates the Holidays on December 6th this Saturday. Sunday. Although different than past years, this year's events proved to be just as fun. There will be Frosty stops, including a visit a Santa drive-through style, a holiday fair to shop local with pre-ordering and curbside pickup, a map of decorated homes and businesses for viewing and voting from December 5th to 13th. and more holiday fun. Please make sure to note the days and times of the activities noted for each location as they vary. Start your shopping early and make your holiday plans by viewing the event brochure at tinyurl.com/GCTH2020 and visiting the recreation website at graftonrec.com for complete details and links to the event. All right, so thank you very much. So first up, we have a public hearing, transfer class 2 license. If I could ask the clerk to please read a motion to open the public hearing.
Sure. I move the board vote to open the public hearing for the application of Mark A. Newhouse to transfer the Class 2 auto license located at 21 Shrewsbury Street, Grafton, Mass. The applicant, Mark Newhouse, is seeking the transfer of a Class 2 auto license. Do you want me to keep going? Or do you want me to just do the motion?
We'll just do the motion, then we'll read the public notice.
Sure.
It's fine.
So I just moved that the board vote to open the public hearing for the application of Mark Newhouse to transfer the Class 2 auto license located at 21 Shrewsbury Street in Grafton, Mass.
Do you have a second?
I second the motion.
Motion made and seconded. Any discussion on opening the public hearing? Hearing none. All those by roll call vote, please. Mr. Fazio.
Fazio, aye.
Ms. Roy.
Roy, aye.
Mr. Often.
Often aye.
Mr. Prisby.
Frisbee, aye.
Peter Carlson, I declare the public hearing open. Thank you. If I may ask the clerk to please read the applicant information for the permit.
I'm going to read the legal notice if that's okay.
fine. Thank you. Yes, sorry. I'm on the next page.
The select board will hold a public hearing on Tuesday, December 1st, 2020 to hear citizens' comments on the application of Mark A. Newhouse to transfer the Class 2 auto license located at 21 Shrewsbury Street, North Grafton, Mass. from Zayed Simran and Ahmad Simran doing business as ZA Auto to Mark A. Newhouse doing business as Sturbridge Motors, Inc., 210 Charlton Road, Sturbridge, Mass. 01566. The Selectmen's meeting begins at 7 p.m. and will take place via Zoom. The meeting link will be posted on December 1st, 2020 agenda. Interested citizens are invited to attend this public hearing and to offer any written or oral comments. Written comments must be received by noon on Tuesday, November 24th, 2020, Grafton Select Board.
Thank you. Good evening. Would like to welcome Sturbridge Motors here with regards to transferring a Class 2 license. Did you want to take a few minutes, introduce yourself to the board and give an overview of what you're looking to do? I know what we said in the motion, but if you want to give yourself a few minutes to go over it.
Sure. Sturbridge Motors, Inc. has operated for 26 years a car lot and a automotive body shop facility at the 210 Charlton Road address. We are expanding our operation into the Grafton area. We specialize in over-the-top customer satisfaction, very transparent in our business transactions, and we build a business and build relationships. It's how we it's our business model. It's how we do business. We also have a towing concern, cruise control, transportation, and some of those vehicles from time to time will be located on the facility, but there will never be at any time more than the 10 allowed vehicles on site. So that basically that's what we're doing. We're expanding into your neighborhood and your area, and we appreciate the opportunity to do so.
All right. Thank you very much, Mr. Newhouse. Does any of the board members have any questions before we turn it over to the public? All right. Anyone from the public who wishes to speak during the public hearing?
Just to note, there was no written public comment submitted as well.
Thank you very much, Ms. Roy. Okay, I'm not seeing anything, so this is just for a transfer. So at this point, I can take a motion to close the public hearing.
I move the board vote to close the public hearing for the application of Mark Newhouse to transfer the Class 2 auto license located at 21 Shrewsbury Street, Grafton, Mass.
Motion made and seconded. Any discussion on closing the public hearing? Seeing none, all those by roll call, please. Mr. Fazio,
DeFazio, aye.
Ms. Roy,
Roy, I.
Mr. Often,
Often aye.
Mr. Prisby.
Frisbee, aye.
Peter Carlson, I declare the public hearing closed. Thank you. At this point in front of us, we have a consideration for a motion for transfer of license. If there isn't any other questions, I can entertain a motion.
I move the board vote to approve the application of Mark Newhouse to transfer the Class 2 auto license located at 21 Shrewsbury Street, North Grafton, from Zayed Simran and Ahmad Simran, doing business as ZA Auto, to Mark Newhouse, doing business as Sturbridge Motors, Inc., 210 Charlton Road, Sturbridge, Mass.
Second.
Motion made and seconded, transfer license. Any discussion on the motion? All right, seeing none, all those by roll call, please. Mr. Fazio,
DeFazio, aye.
Ms. Roy,
Roy, I.
Mr. Often,
Often aye.
Mr. Prisby,
Frisbee, aye.
Peter Carlson, I declare the motion carried. Thank you, Mr. Newhouse, for coming in. Good luck at the new location. We look forward to seeing you use it. If we can be of any assistance, please feel free to reach out to the town.
Thank you so much for your time this evening, ladies and gentlemen. And
Thank you.
have a great rest of the day.
You as well. Thank you.
Bye now.
All right, next up on our agenda this evening, we have the Board of Health to provide a COVID update. So we invited members of the Board of Health to be present here to give a kind of a state of the town with regards to COVID, any updates that we feel is necessary as this pandemic seems to be progressing more rapidly in our community, and also give the board members an opportunity to maybe ask some questions. So tonight I have Mr. Dan Finn here attending. Dan, if you want to go ahead and maybe give an overview of what's been occurring, and we can allow some of the select board members to perhaps maybe ask some questions and go from there.
Certainly. Thank you, Mr. Chair, Peter. Most of you realize the numbers because I think you're getting daily updates, but not everybody here does. So I'll just run through today's numbers of positive COVID cases in Grafton. 302 total cases, and actually 19 new, which is a pretty significant increase. However, keep in mind that total cases is actually the number of positive cases since the middle of March. So in actuality, the active positive cases, over the past 14 days or so is more like 60 to 65. It makes it a little more digestible, but Grafton is still in a yellow color status, and that's a rolling average, and it will come out again this Thursday, and we'll see. There are a number of towns around us that are in red status, and a few towns that are serviced by the Alliance, specifically Leicester, is at 336 total, Holden 414, Shrewsbury 796, and of course the city of Worcester is approaching 10,000, 9,673. By the way, Karen GG, our chair, had a work commitment this evening, so she could not be here. Excuse me. And I think we're all optimistic about the coming vaccines in the very near future, but we're still have to be very cautious going into these next 3 months or so. It's not going to be over by the first of the year by any means. And so, we're still urging everyone to follow the guidance and recommendations of wearing masks and washing hands, social distancing, and staying out of crowds. So I don't know if there are any other questions you might have for Austin and I.
Thank you very much, Mr. Finn. So any of the board members here, I see Mr. Roy and then followed by Mr. Prisby.
I just want to say thanks for coming in tonight. In preparation for tonight, I was reviewing the numbers because we did start receiving them back in the middle of October.
Mhm.
And in the last 3 weeks, it's actually 129 cases of those 302 have occurred in the last 3 weeks. Are
Okay.
there any additional steps the Board of Health are considering to implement in Grafton that are above what the state has already recommended?
Well, I think we have a meeting on Monday, and it's on the agenda actually to look at potential other steps I think we want to follow the state guidelines, certainly. We also have a couple other things on the agenda on Monday that, in terms of winter sports, looking at that with the superintendent of schools. I'm not sure we want to jump out there and reduce the number of people in restaurants. We're all, promoting and want to see small businesses survive. But again, it's on the agenda on Monday, and I'm glad you clarified that number because that's larger than I thought.
All right, thank you. Mr. Prisby?
Thank you. Thanks, Dan, again for coming in. I concur. It's good of you guys to be here. Obviously, the numbers that are being reported to us on a day-to-day basis are increasing. I don't know that the general populace is keeping as close attention as we all are because we get these emails every day. But there has been an alarming trend, in my view, upward. We were going through the summer where there would be a few days at a time where the number in Grafton was 0. And then as the fall had led on, it would be 1 a day, 2 a day, 3 a day, sometimes as much as 6 a day. And that would be a heavy day. When we got 19 today, I felt like something has shifted, and not as far as the coronavirus is concerned, but as the coronavirus is concerned locally. And when I go out and I tell people about these numbers and I encourage them to be careful and wear masks and socially distance, I feel like the message of socially distancing I feel like an old person talking to a younger generation already. I feel like socially distancing was something people did 6 months ago, but they're sick of it now. And when I tell people it's 19 new cases a day, they say, oh, well, shrug their shoulders and go about their day. And a lot of time what I get is a little bit of pushback about the increased numbers saying, well, that's a lot of new testing. The reason why you're seeing more numbers go up is more people are getting tested, which may well be true. So how can we interpret this data on an apples to apples basis and make any determination about how much more stringently we should observe social distancing guidelines, or maybe how much, or maybe does this give us perspective on, okay, yeah, you saw that there were 6 cases a day back in September, but that was because 13 additional people weren't getting tested and now they are. So what steps can we take about interpreting that data? Are you guys tracking the amount of tests that people are getting? And if so, how are you doing that? That I'm curious about that.
Yeah, well, I think you're right. Although this was pretty predictable. The scientists have been saying for months that come the cold weather with more people indoors, and then coupled, as you said, with more people coming home from college and getting tested, the numbers are bound to go up. But you're right. I think it is more of a crisis than most people realize. I wish the Alliance was here because Karen could better answer the tracking, that they are in fact tracking the total number of tests, as well as the positive cases, and putting that into this MAVEN reporting, state reporting, epidemiological reporting system. I can't give you the exact numbers, but I know it is being tracked. And, I think it does warrant more public attention. Somehow we have to get the message out there that it's not over. Everybody's tired of hearing about it, but we're going to have to just somehow get the message out to stay strong. There was another issue we're going to discuss as a board about signage and just getting physical signs out there. And on the website, again, we'll talk about it on Monday. I'm glad you brought that up, but we just have to stay strong and keep hammering home the need to stick with the basics. I don't know that we can do a whole lot more than that. But again, I'll see if we can get the numbers to you from the Alliance on the total cases versus positive cases.
Mr. Finn?
And Mr. Chair, if I could follow up just for 1 second.
Sure.
Sure, go ahead.
we get total numbers. And again, one of the things that I get a little bit of pushback on as well, of those 19 new cases, how many were very serious? Because kids can get this and it's no big deal. And I push back on that as much as I can. I feel like it's my job to give people sort of conservative advice that would, keep them safe and not scare people necessarily, but really give people the straight dope about, okay, but there's a downside of maybe some of the choices that you're making. And we do have to be smart about this data. We do have to interpret it correctly. We have not traditionally reported deaths to the general public. We've stayed away from that. And I wonder why, because from my perspective, the more I go to the public and I say 3 new cases, 6 new cases, 19 new cases, and if you're staying in your little bubble and you don't know anybody that's been severely impacted by it, you might be lulled into the sense of thinking, well, Prisby keeps telling us that there's all these new cases, but yet who's really dying and we don't tell them. So I think that part's important. I think we ought to be communicating to the general public what the serious downside is of taking risks now that you might not have taken just 6 months ago in the face of a pandemic that seems to be picking up steam in the winter.
Yeah, I agree. The last number I heard was 11 deaths in Grafton. And, but you're right, I didn't hear that until a month ago, and I was actually surprised. And Grafton does not happen to have a number of senior living communities compared to, say, Shrewsbury or Westboro. And those numbers are much higher in terms of deaths or fatalities. So, I'll bring that back to the board and mention it for discussion as to how we can get the word out and they're not good numbers to hear, but the public should know them for sure.
Thank you.
And I just wanted to let you know, I've got Ms. Clark from the Alliance as well as Dr. Hirsch and Dr. Mueller from your board also joined. They were in the attendees and I promoted them to panelists, but they're here tonight.
Oh, great.
So Ms. Clark, you had your hand up before Mr. DeFazio. Ms. Clark and then Mr. DeFazio, please.
Sure. Good evening, everyone. I'm Karen Clark. I'm the Director of Public Health for the City of Worcester and for the Central Mass Regional Public Health Alliance that Grafton is a part of. I'm more partial to using WebEx, so I actually have heard the whole meeting. I just wasn't on the screen, so apologies. So I'm glad Dr. Hirsch was able to join as well. So we are tracking this. This is obviously something that we've been doing day in and day out for 8 months. This is a 7-day-a-week operation for the City of Worcester and for the communities in the Alliance. We do have an epidemiologist, and we also have 3 public health nurses that are helping us pull apart the data, as well as our partners and friends over at UMass who are very interested in the data as well. Certainly, Dr. Hirsch can extrapolate, I think, more on why we're seeing the numbers. But I'll just say in terms of what we're seeing in general trends, it's really community spread. There's really not a lot of, long-term care facilities. For example, in Grafton, we are seeing an uptick in those types of facilities in the city and surrounding communities. But we are seeing college students, particularly ones that live off campus, that are starting to bring it on campus. We've had a number of clusters at a couple, actually 3 of the colleges of Worcester. And also families that live together in the same household. You will see numerous addresses. We look at all of the addresses every day that when they come in to do some analysis. I think the difference between the first wave and the second wave was everything shut down in the first wave. And since things have opened back up, people are going back to work, people are shopping, people are going out to restaurants. And so what's happening is I think people have had a false sense of security that if you go home and you're in your pod, that somehow because it's your family member, there's not going to be that spread. And that's not true. I also would say frontline workers, there's a lot of people that have to work that didn't have the luxury to work remote. And so we're seeing a lot of communities of color that, you know, are not only supporting people that they're living with large families, but also people that are sending money back to their home country. So there are sort of these levers and drivers, but overall, it's really a lot of one-offs that we're seeing, which means it's in the community. So it's not any particular driver that we're seeing, and this is really across the entire alliance. So we are looking at that. And as far as death data, any community can work with their town clerk to track that. We don't track those necessarily in our office, but certainly I know your town clerk can get that information for you. I think Nancy worked with your town clerk to get that for Mr. Prisby. Dr. Hirsch, do you want to say a little bit about what you're seeing and also in the hospitals, or anything that you want to tell the folks in Grafton or the select board?
Sure. Through the chairman, thank you very much for having us. I've been listening in for the last 10 minutes. I had a little trouble getting in initially,
Yeah.
but I heard a lot of the discussion, and I feel that we are really in the teeth of the worst part of the pandemic right now. The numbers that we saw in the spring were certainly mitigated by the fact that we had the shelter-in-place rule, as Karen alluded to, and people were incredibly compliant with that. And I'm sure you guys remember, if you did get into your car for some reason in April or May, you felt like you were the only car on the road. You did a lot of shopping by curbside pickup and delivery. You didn't see people in the big box stores or in the retail settings. But now, as things opened up over the course of the summer months, and as we saw kind of a beginning of a spike come September, the September spike was not due, as we were potentially expecting, from all the college students returning to the area. That didn't happen on the on-campus modeling of the colleges, where we've consistently seen college outbreaks in the 11 higher institutions of learning, has been in the off-campus setting, fraternity houses, teams living together in buildings, or outbreaks happening because teams continue to live kind of communally and practice kind of communally, even though to a large degree athletics were shut down. The community spread is quite astounding, and we had a positivity rate in the city of Worcester last week whereby 20%, 1 out of 5 of people that were tested positive. And there was a lot of testing that happened last week because everybody was trying, I think, to either be a good recipient of people outside their bubble coming in to visit, or to be a visitor to somebody else's bubble. And the travel that we were really trying to discourage for Thanksgiving, I don't think we were very successful in doing. And we were already in the teeth of a spike because of the activity over Halloween weekend, where there were a lot of folks that decided to do alternatives to trick-or-treating, but the alternatives were parties and other things, where the 3 W's that we're emphasizing, the social distancing, the wearing of the mask, and the washing of hands, were not being strictly adhered to. So we are expecting, because of the Thanksgiving travel, a very large spike. Our epidemiologist, Nikki Nixon, working with our data collection expert, Mike Glazer, in the city manager's office in Worcester, is predicting December 17th as the next big spike we're going to see from this past weekend's worth of activities. And subsequent to that, then we have the Christmas week, with lots of travel, lots of bubbles being invaded. And this is a really tough thing to see, these big spikes with these intermittent super spikes. The hospitals thus far have been managing without doing what they did in the spring, which was to shut down clinics and go to telehealth and video health, and they stopped elective surgery. So far, that has not happened. We were told the threshold number for UMass Medical Center to consider that was 70. They're at 69 as of today, and we have no beds in the hospital right now. We're not running short of PPE. We're not running short of ventilators as we did in the spring. But what we are running short of is healthy medical staff. An average of about 9 to 10 medical providers at all levels, medical assistants, doctors, nurses, are turning positive a day. If that number continues, we will have exhausted a lot of our reserves. And unlike the spring, where we in the Northeast were experiencing this rise kind of alone, in the Midwest and the South and the Southwest were not, we could call on them to get us traveling replacements. There's no place right now. 49 out of the 50 states, except for Hawaii, are all spiking at the same time. And we're in the Northeast not as bad off as those other regions that avoided this bad numbers in the spring. So that's really the critical mass that I think is going to necessitate whether or not we do this lockdown, at least on the hospital level. December 6th, just down the road, the DCU Center opens up again. So far, it is the only field hospital that Governor Baker approved. Our CEO at UMass, Dr. Dixon, has staffed it, and we're going to have, the National Guard has been helping to set it up. It's going to be a 240-bed hospital facility. Back in the spring, it was only used for about 100 beds. In addition, there were another 60 beds for COVID-positive homeless people. The homeless shelter aspect of this is not being recreated this round, because the DCU is going to be a regional center where people from the West can also send their patients to unclog their wards of convalescent kind of DCU COVID positive patients. The COVID positive patient back in the spring was more typically an essential worker that might have gotten COVID and didn't have a good situation at home to isolate, and needed more time to quarantine, and therefore was put in the DCU. This time around, this is going to be almost like a step down ICU, higher acuity, because we're going to try to keep the hospital's business as usual going. I don't know if this is an experiment that's going to work, but there's definitely a big gamble going on that we can continue to have elective surgeries and clinic visits as normal, because I think the thought was, after we got through the lockdown of the spring, there were a lot of patients coming in the summer who had delayed important diagnostic testing and surgical interventions that led to them having more serious problems from having put off their normal health care. And we would like to avoid that, obviously, but I'm not sure that the virus is going to let us. So the last thing I'll say, and then I will turn it back over to you all, and I appreciate the opportunity of giving you an update, is there is this vaccination light at the end of the tunnel. We were told today, actually, at UMass, that there was a very good possibility that there would be an in-house vaccination program for medical providers, and they're trying to come up with a list of the frontline first responders and the frontline medical personnel that would get this starting the last week of December. I'm not sure which iteration of the vaccine we're going to see, because the FDA is in the process of looking at the Moderna version and the COVID-19 Pfizer version. That COVID-19 Pfizer version was actually tested here in the Worcester area. And so I think we have an inside track at getting that particular iteration of the vaccine out. Because this vaccine requires minus 70 degrees refrigeration, and those kind of refrigerators are not plentiful. And because we know that it also will require in the COVID-19 Pfizer version a 21-day booster shot after the original shot. Moderna would require one at 28 days. This is going to be complicated. Karen and our crew at the WDPH have been working at emergency distribution planning since really the summer. And we have a crew of vaccinators. We have a crew of important locations that we can put into play. Some will be drive-through situations. Some will be walk-in situations. It's just tough because it's going to be in the teeth of the winter. We don't know how bad the winter is going to be. And we certainly want to try to accommodate as many of the phase one first responders and medical providers. We also, in that first phase, are supposed to also hit up all the long-term care facility workers and their residents. Then the next phase gets to the people with comorbidities that make them more vulnerable, the community of color, and that is going to be largely based out of the community health centers, but we will be getting some help, I think, from the pharmacies. And then the third phase would be general distribution. And Karen can talk a little bit more about, we have some plans in place to try to promote the vaccine, because there is a lot of skepticism about vaccine in general, about the way this one was cranked out fairly quickly, and also about the general nature of the fear of getting the virus from a vaccination. This vaccine is very different than vaccines of the past, polio or mumps or measles, rubella, or even the flu, in that we're not injecting a dead virus into your body to have antibodies form to this dead virus, or a harmless live version of the virus. That's not how this one works. This is the first time that we've actually taken the messenger from the viral genes called mRNA and injected a piece of this through the vaccine into your body, where it will tell your body to make antibodies to the little tiny spike proteins that are on the surface of the coronavirus. So it's not a complete virus that's getting injected into you. It's just a chemical messenger from the DNA of the virus that will teach your cells to defend the body better. And it's never been done like this before, but we're gonna see how effective it is. The preliminary data is very encouraging.
Thank you, Dr. Hirsch. I know we've got a couple people with some more questions. Thank you very much for that. Mr. Fazio, you had your hand up a few moments ago, but Dr. Hirsch, thank you very much. And I'm sure you'll have some more responses for us in a minute. Go ahead.
Yeah, a lot of my questions were answered. Thank you, Mr. Chair. And thank you, Mr. Hirsch and Ms. Clark, too. A lot of, like I said, my questions were answered. You just gave us a lot of really great information. And I first want to start by saying that, I originally was thinking about public attention here and how our board can bring more attention to this and answer questions. And certainly, Dr. Hirsch, you just brought up a little more information on the vaccine. And I know in my extremely small circle, there's a lot of questions or a lot of assumptions about the general vaccine distribution and what that's going to look like. So I would just like to say that I would like to see a meeting like this, or perhaps our board get more involved with the Health Alliance over the coming weeks so we can come and do a more robust update to the public on what's going on. One other sort of comment I had was I noticed in these daily numbers that come out for the town of Grafton, the demographics seem to spike mostly between the ages of 20 and 29 and 50 and 59. And I bring this up because, again, there's this illusion that older people, typically over the age of 65, are the ones getting the virus the worst and the ones dying from the virus. And from what I've heard from my friends in the medical profession, that is not the case. And I just wanted to get a little more information on why those numbers are higher for those age groups, if it's unique to Grafton or if you're seeing this throughout the Alliance. I sort of made some educated guesses of perhaps college students coming home and their parents are in that range, but I don't want to make assumptions. I just want to sort of know and really put it out to the public there that those are the highest percentages that we're seeing on a daily basis is that time frame. It's not your grandmother over 65 years old, although that is a concern. It is the younger people and people who are middle aged who seem to be getting the virus the most.
All right. Did any of the members have any questions? Dr. Hirsch, did you want to address some of that?
Yes, thank you. And it's an excellent question. And I think you have come upon, I think, the critical difference also between last spring and now. Last spring, we didn't have enough tests, so that we very frequently, when a primary care doctor or a clinic would get a call about somebody that had flu-like symptoms or fevers or loss of taste and smell, we just basically told them, you probably have it. You should start your isolation period at home. And so there were whole swaths of people that never got tested that had it. The only people we were testing were symptomatic, and most of those were elderly. So we've seen a shift overall throughout the Alliance. The average age back in the spring of the patients that we were seeing with positive tests were in the 60s, like high 60s, 67 to 69. Now that age has shifted down to 45, and that's because we're doing asymptomatic testing. Because of the Stop the Spread program that the governor promoted and the Health Equity Task Force that UMass set up with under the auspices of our Commissioner of Health and Human Services, also Dr. Maddie Castile. There have been many pop-up places to do testing in asymptomatic patients, no questions asked. And now we see that probably all along, the younger people, like you mentioned, had it and were getting it. They just didn't get hospitalized in general. So what do we say? Oh, well, it's not that serious in that age group, so it's not a serious problem anymore. Well, the answer now, because we're getting all this data back from people who got it in the spring, is long hauler issues are being described across the country. So many that in New York City, they just started up their first post-acute COVID center at Mount Sinai Hospital, because so many of the youth that got this in the spring that didn't think much of it and tried to go on their way once the big spike in the spring was over are now coming back with problems in their lung, problems in their heart, what's called COVID brain, where they're having difficulty focusing, other kind of neurologic symptoms, needles and pins, tics, GI issues, problems with muscle weakness. So you have marathon runners in New York City that no longer can walk a city block. You have personal trainers that have been stricken that can't carry a bag of groceries anymore. So this is something that I think we've been trying to emphasize. Nobody really knows what the long-term effect of this virus is going to be. I mean, there's viruses like herpes that come back, every other year or every year. They plague you for your entire life once you get it. We have viruses like chickenpox that come back as the shingles when you're elderly. We don't know what this is going to get. And so that's why the idea of getting it and getting it over with it and, saying, okay, I got it, now I'm immune, is not the healthiest approach to this. We need herd immunity that comes from a vaccination program, not from everybody getting sick. And in Sweden, where they tried this experiment of not trying to, block the spread of the virus, just let everybody get it, they are seeing a very high rate of this long hauler effect. So I think that that's the messaging that we've been trying to emphasize now is this is serious. Young people can get it. Young people seemingly have a milder case initially, but they're coming back with these weird things. So you don't want to do this. You don't want to be that person. You want to try to stay in your bubble, follow the 3 W's, hopefully get a flu shot and eventually get the COVID shot. And that's going to help everyone get the herd immunity that we need of the right type.
Thanks, Dr. Hirsch. I swear every time you talk to us, last time you were here during the Triple E West Nile outbreak, I want to go out and just do my part to be more safe. But thank you for that response. Does anyone else have any other questions for the Alliance or the Board of Health? Ms. Roy.
I would just like to pose my question I asked earlier to Dr. Hirsch and Ms. Clark about, are there any other steps a community can take above the guidance that the state has issued to us? It's really concerning to hear that December 17th is coming to us and we're just going to stand by and let it happen. Is there anything that you would recommend for us to consider doing?
Ms. Clark or Dr. Hirsch?
Sure. Can you hear me?
Yes.
I don't know what is going on here. Sorry. Hitting different buttons. So local Board of Health obviously can be more strict than what is going on at Mass DPH or even if with the governor's orders. So our city manager has signed an executive order and so our city manager can do this as well. Had signed an executive order back in September and then just amended it again. I think it was last Monday, that we're going to stay in phase 3, step 1, which means that restaurants will continue to have no more than 6 at a table and also no seating at the bar. And essentially, so just to kind of back up for a second, there's been a lot of confusion and quite frankly, frustration, I think, across the Commonwealth with local health departments and boards of health with the ever-changing metrics and the heat maps. And for quite some time, a community was considered high risk if it was 8 or more positive cases per 100,000, which Worcester was pretty much crimson for some time in some of the surrounding communities. Which wasn't surprising because people are traveling back and forth, and also some of the yellow communities. That metric actually got changed a few weeks ago by the governor's office, and now it's, I believe, 25 or more per 100,000. So despite the fact that Worcester has been quote unquote yellow for a few weeks, we could have actually rolled into step 2 of phase 3, which would have been the 10 people at a table and then seating at a bar and a restaurant, but with plexiglass. I'm just using the restaurants as an example because we are seeing positive employees at restaurants, in particular in the city of Worcester, because we have a lot of them. And so we have daily conversations, and we also do a huddle with the city manager. Every Thursday, he does a press conference with Dr. Hirsch and the mayor to show, that this is serious and everybody has a message that they bring forward. But we have decided that we're not rolling forward, even though we could after being 3 weeks in this yellow zone. Because when you look at the numbers and you look at what's the drivers, we just don't feel comfortable moving into another phase, even though we are allowed to do that. Looking at the numbers, it just didn't make sense to us. And so, there's a number of things that could be considered. That's just one of them. But, certainly we can support the board in exploring what other communities are doing or what Worcester's doing. And I know, there's a big discussion about, keeping kids in school, and we obviously understand the social, emotional impact that it's taken not only on kids, but also how stressful it is for parents. But we believe that the new metric that came out is really to try to support in-person learning, which we also support, but we're also tracking the information and sort of figuring out, well, who is positive? Is there spread in the schools when they do have in-person learning? So I think when you start seeing numbers like this, I think all these conversations need to be on the table. There needs to be multiple partners at the table to sort of make these decisions based on the data. And certainly will be myself or one of our Alliance staff will be at the Board of Health meeting on Monday to further unpack this. A few things I just wanted to mention to the board, if I could. One of the things that we're trying to do, and it's been successful so far, is we've been having targeted sector town halls. So we've had WebEx town halls with our, health code, police, Dr. Castile, Dr. Hirsch. And we've had, restaurant town hall, which went really well. We did another one for retailers, for home, landlord associations, that kind of thing. The wave of complaints, and I'm sure Nancy can attest to this, not only in Grafton, but across dozens and dozens complaints of people just not wearing masks, whether they're in the common areas of apartment buildings or, but big box stores, and staff not wanting to confront people that are not wearing masks. And people are sick of it. I mean, the fatigue is real and we get that. But we're trying to just educate people, and also people don't know exactly what to do if an employee is positive. And a lot of times people are closing their establishments to do a cleaning or using their own employees to clean. We would want a professional cleaning done. And we want to walk people through and let them know that we're a resource for them. So I did see that the law has just changed, that there is a requirement, there wasn't prior to all of this, that businesses have to notify local public health, their local Board of Health, if they do have positive employees. And that letter supposedly went out yesterday to like every business in Massachusetts. So I just wanted to flag that for the board. Sometimes we don't find out about these things unless they're on Facebook. And obviously the sooner we know, we can isolate that person, we can work on testing. All of us, our goal is to keep people healthy and to keep them open. So we're really a partner in this. It's not about punishment, it's about compliance and keeping people safe. So we're trying to change the narrative and let business owners know and residents that we're here to support them. Another thing, so we could consider doing a town hall, a general one for your residents, or we could look at businesses. We could tease it apart like we did in Worcester with different sectors. Couple other things, our cable services in the city of Worcester just developed a whole bunch of flu and COVID PSAs that I sent to Carter and Nancy yesterday. They have the Alliance logo at the bottom. You can post those all over social media. I would suggest you put them on your local cable. They're all ready to go in a file. I sent that yesterday. Some of those are in Spanish, which is great. And a couple of other things that Grafton will be seeing. We're working on a mask campaign that's really going to be targeted towards some of the younger people who think that they're immune to this, which we know is not true. And this is something that it's going to be in a competition. We're going to be rolling this out, but basically getting people to design a mask, and then we'll be printing it on the mask, whatever the design is, whoever the winners are, just to try to get them more engaged in a different way and be part of the solution rather than just talking at people. And then the last thing is I would just mention is Dr. Hirsch and I met with a foundation this morning who is looking to give Worcester DPH $100,000 to work on a vaccine education campaign. And it was specifically mentioned that one of the appeals to them, to the board of this foundation in working with us was because they wanted to utilize the public health district that we're in, our regional approach, to really work with and educate residents and employees that are in all 7 communities in the Alliance. So I know we don't see you often, but I just wanted you to know there's a lot of stuff going on. And we're trying to think of every creative thing that we can just to try to mix it up and think of different messaging and to try to get people to take ownership and responsibility for their part. So a lot of that stuff will be rolling out. So however we can help you reach people, we're open to doing whatever needs to be done, and certainly we'll make ourselves available.
Thank you, Ms. Clark. I appreciate that.
Sure.
Mr. Finn, I'm going to talk to get Mr. Opton first and then follow up with you. Thank you.
Yeah, thanks. A lot of great information tonight. I really appreciate all of the exchange. It's been really useful for me. I wanted to just focus for a minute on local monitoring of compliance with state guidelines and monitoring, management, and enforcement. So I think this is a very pro-business board for sure, but part of that depends on our business and businesses and how they essentially act in town, and part of that is we have our license renewals coming up tonight, and I've been to a couple of the Board of Health meetings, and I have made note of a few issues that have come up this year. So I guess I just am interested in hearing from our Board of Health members that are here tonight. How do you guys feel like it's going in terms of monitoring, management, and enforcement with compliance? Do you feel empowered and backed up by the town and this board? And, is there anything that we can do to help in that regard to just make sure that, all the businesses in town are kind of towing the line with this? Because it's probably the single most important thing that we can do in town to help kind of suppress the community spread is in our businesses, right? So at least as a board, it's one of the important things that we can do. So I'd be interested in just what your perspective on that is.
Mr. Finn or Dr. Mueller or Mr. Magnet, do you have any comments or anything you want to go in? Mr. Finn, go ahead.
Yeah, I think that's a good point, Matt. Thanks for bringing it up, that enforcement has been a little tricky at the local level, and we have an extenuating circumstance or two as well, a complicating one. But in any event, Cindy just put together a list of complaints over the past 9 months, 10 months. I don't know if your board has gotten that list of businesses of educations and warnings and things like that. I think she reached out to the Board of Health, but also to the building department and other departments in town. Have you folks seen that list, Matt?
I don't believe we have seen that just yet.
I just saw it this afternoon, and I think I'd like to bring that to the Monday's board. Now, the other question is, are you folks, we typically sign the permits and we look at certificates of insurance and if they pay their fee and whatever. But do you folks authorize the licenses tonight, did you say?
That
Yeah,
is
but
on-
agenda tonight, Mr. Finn, too, for the annual license renewals tonight, for all the businesses. So that is on the consideration tonight.
Okay. I mean, I guess that is, if we had thought of it earlier, it would have been a nice piece of leverage to require either to have someone that's a business owner or business owners that have been consistently delinquent in terms of the guidance or recommendations, or in some cases, governor's orders, to come in and speak, or at least send a written attestation or whatever that they in the future will comply with these things. And again,
There's no reason to not to consider that. I mean,
Oh,
if this
Mr.
is
Frisbee, wait a second, let him finish. I know that. We'll get to that. I promise.
you know, I'm just thinking if we have a little more time, I'd be happy to bring that to the board for discussion on Monday and see. I don't know what, if you can possibly postpone your licensing issuing for another week or so, but I don't think we have a meeting to sign permits on the 28th of December.
Mr.
So it's
Finn,
not-
we could certainly consider that, but I want to go to Ms. Roy and then back to Mr. Frisbee, please. Go ahead,
Sure.
Ms. Roy.
That was all I was going to suggest, is possibly postponing the license renewal until we had all that information.
Mr. Frisbee, were you going in that same direction?
Yeah, I mean, I just want to say I get a little bit frustrated with the safety versus economics argument. This is the same thing. This is the same thing. Dr. Hirsch mentioned sort of in passing, you know, this idea about a lockdown. We did it 6 months ago. It was economically painful. We've learned a lot about the virus since. We've learned a lot about how the virus is transmitted. And we've learned a lot about where people go indoors in large groups to contract this virus themselves and then spread it all over. If we get to a point where the numbers get so bad, and you can change whatever color on a map that you want to. Worcester's as bad as it is, whether it's yellow or red. Grafton's as bad as it is, whether it's green or yellow. Okay? If it gets bad enough and people are feeling lackadaisical enough, then the economy gets harmed. If I'm out of a job or my spouse is out of a job because of the effects of COVID, I don't have any money to spend at your restaurant. So people need to take it seriously. And if we need to get people in here to tell them to take it seriously before their license is renewed, then that's what we got to do. So this whole argument that it drives me nuts about, oh, well, you know, you're so mean to businesses. No, you have to keep people alive. We're talking about how many people at the restaurants have COVID, walking around, non-symptomatic, passing it to other people because people just have to get out. Well, but I'm in my bubble. Bubbles have a funny way of moving around, I've noticed. I'm in my bubble. My bubble's my neighbor. We go out to drinks. Your neighbor goes to work with other people in their bubbles. There's no such thing as a bubble. I wish we should stop using the word bubble. You're not in a bubble unless you're literally in a bubble in your home. You're not in a bubble. Can we stop using that phrase? It's ridiculous. This idea that because I have friends that I trust. We're not talking about herpes. This isn't the same thing. You have friends that you trust. They don't know they have it, and you can get it from breathing near them. So I think we should stop using that phrase. What was curious to me as we led up to Thanksgiving was the message that was coming out from the Commonwealth of Massachusetts, which was don't gather with your family in groups of more than 10 unless you're going to a restaurant. Then by all means, go gather with other groups of 5 and 10 people in the same place, breathing the same air. And that's perfectly fine because we want to keep restaurants in business. We are at a point now, and this is just for me to you guys, and you're doing a wonderful job, but the messaging that I need to bring back to people is this is a data-driven analysis. We know where people are getting this. We know what age groups are getting this. We know what the health risks are, and we know what the repercussions are. If we can transmit that information to people, we can empower them to make better decisions for themselves. That way, I mean, I know there's always going to be a few people that are going to say this isn't happening. I read the stories about people that are on their deathbed saying this isn't happening to me. I get that. But there is a large swath of the American public that will understand that there are risks associated with doing certain things and that if they can stay away from them, they should. And if we can get people this data, all the better. Thanks. Sorry I had a rant there, but the bubble thing drives me crazy.
Does anyone else have any other questions? I think, there's a meeting coming up on Monday with the Board of Health and the Alliance. Sounds like there's some data to be reviewed. Consideration for one of the agenda items to be postponed tonight to the next regular business meeting, which would put us out 2 weeks from today. Is there anything else to go over real quick, or can we wrap this up? Mr. Finn?
Yeah, just to finish up, I just want to mention to Colleen that I'll be happy to get her question on next week's agenda on Monday regarding the possibility of cutting back locally and what those options are, and work with the Alliance on those ideas too. And also, if you decide to postpone the licensing for a week, I'd be happy to get that on the agenda as well, because I think the whole board should have some input on that, on those decisions.
All right. Does anyone have anything else? All right, a lot of great information tonight. I know we'll have more information Monday at your Board of Health meeting and then follow-up conversation later in this agenda. I want to thank the Alliance, Ms. Clark, Dr. Hirsch for coming out tonight. Mr. Finn, thank you very much for you and your board. Mr. Magnet for coming out, and just a shout out to Karen and I know Josh, as well as, I'm sorry, I'm missing the other person's name who just joined, but
Dr. Muller.
Dr. Muller, thank you. But also Nancy Connors in your Board of Health office. I'm seeing emails from her 7 days a week, and I know that's I just want to give a shout out to her. That's your basically your only person in that office for the town, Mr. Finn. But I just wanted to thank her for her tireless efforts and keeping us all informed of all these developments.
Yep, she's been great. Thank you.
Thank you. Okay. Thank you very much, everyone, for coming out tonight. We really appreciate your time and your insight and your information. Thank you.
Yep. Have a good night. Stay safe. Thanks.
You as well. Before we go on, Mr. Scarlett, I'm sorry to call you out here. I noticed you're in as a panelist. I didn't have you listed tonight, and I know we chatted earlier. Did you need to be in the panelist section, or do you need to be in the attendees, or?
That would be fine, Peter. I don't know how I got in here either.
Okay. I think because we use the Zoom account, and I've done that once before, trust me, and I was embarrassed. I was like, oh, what do I do? All right. I can't put you into attendees, but if you want to exit and come in through the link from the agenda, it'll put you into the attendees.
Okay.
All right, thanks. All right. Next up here, we have a library change order. We have Mr. DeShane here, who's our OPM for the library. Andy?
Good evening, thank you, Mr. Carlson. Yep, good evening, everybody. So the change order for this month for the library project, one note ahead of this, these change orders are trending in the right direction in that they're going down every month. Right now, this one is for $193,000, which is a lot of money. The potential change order for next month is far, far, far below that. So this job, as you know, has been, in terms of change orders, has really been driven by the site. If you take the site change orders out of the equation, which we really can't do, but if you did, we're at 3.5% of change orders for the total job so far, which is, for a job of this size, is actually very good. So this change order number 13, again, its total is $193,158.19. As I said in my cover sheet, this kind of falls into three categories, similar to the one before it. There are a couple that are tied to just adjustments that come along with marrying the new building to the old one, and some surprises, small ones that we found along the way. There was one part of this change order is about some revised details based on some back and forth between the general contractor and the subs, just basically unclear scope that got clarified, and the result was a small increase. And then the biggest piece of this is, again, just the sort of the last piece of what we've been seeing for contaminated or unsuitable soil. So some of these have been coming for a while. The removal of underground tanks number 2 and 3 happened in July. It's just taken a long time to get through all the removal of the dirt and to quantify all this stuff and get the pricing back and all together. So some of those happened, not recently, but the pricing is just coming through now. So that's what the majority of this one is in terms of cost, is just the contaminated or unsuitable soil. So again, total is $193, $158, and 19 cents. I'd be happy to take any questions. I guess the other thing I think I mentioned is that I keep a weekly update on my cost report, and as these things come in, I roll them into that cost report. So I've already got this. This is already part of that look ahead for costs, and we've got a remaining contingency of over $430,000 at this point. So, and the majority of the risk is out of the project right now. So we're in good shape in terms of cost.
Thank you, Mr. Duchesne. Does anyone have any questions? Mr. Often.
Yeah, just quickly, can you just explain a little bit of the over excavation? That's just a large component of the change order, and I read through it, but I really just didn't understand what it was. So if you could just go over that quickly.
I'd be happy to. Yeah, this one is. I was sort of expecting somebody to ask the question because it's a fair amount of money. So this was actually the southern part of the new parking lot that stretches back along the railroad tracks. We have a geotechnical engineer consultant who is out there when we're doing excavation, and is basically looking for suitable material, making sure that we're excavating down to a material that's stable, that can support, even in this case, can support just a parking lot. And basically, he is literally there watching them excavate. And when they get to the engineered depth, if it's fine, they stop and they move on. If what they get down to, if they're going down 18 inches and they get to 18 and it's still not good material, in this case, it wasn't. They have to keep going until they get to something that actually can support what needs to be there. So that's what we ran into. There was a lot of clay in that. There's a big pocket of clay back in that location back there. Not contamination, but just lousy material. So we had to over excavate and then fill it back in with good material, literally just to support the parking lot. So kind of an unfortunate piece, but not a lot of control over that part of it, because we've got, a professional telling us this stuff is still unsuitable, keep going.
Right, absolutely. I think the lesson to be learned is the thing that we do have control over is the amount of contingency budget that we put into these large projects. So I think the library did a pretty good job. Maybe not quite so much with the DPW building.
Yeah, I think it's that, and it's doing more subsurface testing ahead of time whenever possible. I mean, you can't do too much pre-construction, pre-design subsurface testing.
Absolutely.
Sometimes it's not possible because there's a building in the way or something like that, but nobody wants to spend the money ahead of time, and it's always worth it.
For sure. Thanks.
Thank you. Mr. Fazio, and then Mr. Prisby.
Thank you, Mr. Chair. I actually had the same question as Mr. Often, but I also just wanted to make a comment, which is that I didn't know what to do with myself last Tuesday since we didn't have a meeting. So I toured the library with Andy, and I would have invited any of you to come, but based on our last COVID discussion, I decided to just go alone with my mask and walk through the space, and I would encourage any of you to do the same, because it really, it's amazing to look at the bones of the new space versus the old space. And it's really exciting to see, way before the finished structure. And it also gave me, even though I've been on these library committee meetings and, can think about these change orders, it helps me now to really have a visual of what the space is. So I just wanted to thank Andy for that. And I know, that invitation is open up to the rest of the board too. So I
Absolutely.
would encourage that.
Thank you, Mr. Fazio. Mr. Brisby, do you have a question?
Yeah, actually, Andy, the last part of your answer got into my question. I guess it's one thing to get 18 inches below the surface and discover the soil's unusable, but they must have done some subsurface analysis and boring in that space, didn't they? Or what
No,
happened
all the
there?
borings were done around the building footprint. So we didn't go back to the parking lot. Normally, almost anything will support a parking lot. I mean, there's not that big of a load. There's no truck traffic. It's just basically cars. So it was a little surprising to get back there and find that material to be in such poor shape. But again, to my point, there's no reason to not do more of that to begin with. Even in a parking lot, it's worth the small expense up front to be able to do a few more borings just to be able to kind of quantify what you've got.
Thank you. Mr. Often.
Yeah, thanks. Andy, I'm wondering, I understood all the other change orders. The lower level finishes, was that, were those unforeseen? Has that a change to the finished materials that they're putting down there? I didn't quite understand that one.
So essentially, there was some of the walls that were down there when they were uncovered. What was behind them was in worse shape than was anticipated. So there was some additional work that had to happen, and in fact, instead of leaving them as they were, they needed to be stripped a little bit more, and new material is going to be put in front of them. So that's kind of what that was. It's the old building syndrome. You open something up and you realize that it was worse than you thought.
Got it. Okay, thanks.
All right, any other questions? Okay, so tonight we have a motion before the board with change order number 13. If there's any more questions, I can entertain a motion.
I move the board vote to authorize the chairman to sign the library change order number 13, the CTA construction managers in the amount of $193,158.19.
Second.
Motion made and seconded. Any questions on the motion for the change order? Seeing none, all those by roll call vote, please. Ms. Roy,
Roy, aye.
Mr. Often,
Often aye.
Mr. Brisby,
Yeah.
Fazio,
Fazio, aye.
Peter Carlson, I declare the motion carried. All right, thank you very much, Andy, for coming in tonight. All right,
Thanks, everybody. Come on by.
Will, thank you.
Yep.
All right, so
Thanks,
next up on our agenda, I just want to thank Mr. Spinney and Mr. Velataro for sticking it through. I know it's about 8:15. We try to get all of our invitees up in the front of the meeting, but we had a lot of updates on COVID-19, but I want to thank you for your patience.
Mr. Chairman, I'm sorry to interrupt, but it seemed like we have a hand raised from an attendee or someone from the public. So I just want to mention that.
Yeah, we had a public hearing earlier and I didn't see anyone raise their hand. Do you know if this was just something recent coming up? I just didn't recognize it until now.
It wasn't up before because I've been paying attention. So I just want to make sure it wasn't for this issue. Up to you the way you want to handle it. I just wanted to let you know.
So does the board want to allow question to come into us? I'm not sure what it's about. So, okay. Oops, I did the wrong one. Sorry, Cindy, I didn't mean to bring you in. Ms. Foley, can you hear us?
Yeah, I can. Too late. Thank you.
Okay.
I had my hand up earlier for something else as well as this one, but okay.
Did you want to ask your question now?
No, I'm good. Yeah, it's too late. You already voted. Thanks.
Thank you. All right. So we have up here action item here, Noble Manor HCA seeking to request a transfer of a community host agreement. I have Mr. Spinney here tonight and Mr. Velataro. Do you want to give us an overview of what you're asking us tonight.
Sure. Thank you, Mr. Chairman. Bruce Finney, 71 Potter Hill Road. I am the sole representative of Noble Manus Finney Enterprises, the holder of the HCA currently. I have taken on a partner to move forward with my projects at 130, 134 Worcester Street. Alan Villatoro is here with me tonight, also a Grafton resident. We needed to segregate my two entities, one holding in Mendon and this particular interest. So what we were trying to do is come before you tonight and request a transfer of that HCA agreement over to the new entity. You should have all been provided with an email stating what we needed directly. And we're looking to have that done tonight and move forward. We're proceeding with our provisional license application, which we hope to have submitted by the end of this week. This, of course, is one of the pieces that we need. We just conducted our outreach meeting this evening. I know we had done one in the past, but you have to do them 6 months before you submit the provisional. So I also wanted to take this opportunity for Alan to introduce himself to the board. If you don't mind, Mr. Chair.
Villatoro?
Excuse me. Thank you very much, Mr. Chairman. First, I want to thank everybody for taking the time to listen to what Bruce and I are proposing here. And just give you a little bit of a background on myself. I did grow up in Marlboro most of my life, but over the last 8 years, I've called Grafton my home with my wife, our two kids. They're not old enough to go to school just yet, but I'm looking forward to them being enrolled in the the school system out here. Myself, I really come from a banking background where I specialize mostly in banking on the retail side and on the commercial side, on the lending side. I enjoyed it thoroughly, but over the last couple of years, I've decided to pursue my own business interests, and this opportunity, took a lot of decision making and a lot of research. And working with Bruce has been, fantastic in the sense that I've been able to create a good synergy amongst what we're trying to accomplish here. So I'm excited to be here, and I'm excited to discuss the project. So I'll let Bruce take it from here.
Thank you, Mr. Villatoro. I said Villatoro earlier. I apologize for mispronouncing your last name.
You wouldn't be the first, and I'm positive you won't be the last.
I'm seeing the O's as an A right now at this hour at night, so my bad. Your printed up A big for people who want to see it at home.
I was going to say I apologize in advance if you hear my daughter's crying in the background, because this is around the time when it gets to that point. So thank you.
All right, thank you, Mr. Spinney.
Sure. So just briefly, this is a simple transfer. We did one when we did a name change in the past to move it from a holding company to the actual entity we were moving forward with. Certainly things have changed over the past year, both on a global level and also on a local industry level. Seeing that I'm here, of course, if there's any questions that the board members have for us, we would be happy to address them. I know that in the past couple meetings, you've talked about moving forward and looking at adjusting policies and things of that nature. I would kindly like to avoid those things, but I would be more than happy to come back. But for this evening, we're just looking for a motion or a vote to transfer the agreements, and also by extension of that, also get the affidavit signs that the CCC requires the town to produce a affirmation of the host agreement being properly in the proper hands, and also that an outreach meeting was conducted.
Bruce, if you don't mind, if I could add on to that, throughout the process, as I'm sure you've learned, is quite rigorous, and part of what we have going on right now is a full team of executives that have really been put to work over the last couple of weeks in hopes of getting this timeline achieved in a rather quick manner. Amongst that group, we've engaged the services of tax attorneys, CPAs, corporate attorneys, cannabis consultants and attorneys, construction project managers, architects, civil engineers, and some of those have actually been from the Grafton area. So, when Bruce says we're looking to get this thing done in the next week, we've committed a significant amount of resources behind this to ensure that we move at a fast pace. And, this is a huge opportunity for us to do that, in a timely manner. Thank you.
In addition to that, we've been very, very kind of blessed, so to speak. You have contractors in town, architects in town that we've been able to add on to the project, trying to source as many of our vendors locally as we possibly can. My provisional license application was submitted a few weeks ago for Mendon. That's a separate entity that I partnered with for that. Part of this industry is just as much about getting capital to see these projects to fruition as it is anything else. So the direction that we took in Mendon was submitted. Both Alan and I are both expedited review candidates. It only took about 48 business hours for my application to be reviewed in Mendon, which is pretty exceptional. We figure we'll be on track for our provisional license over the next couple months. We're also ready to file with the planning board. We've done most of our site plan work already with our civil engineer and our architects. We've done our wetlands delineation thus far as well, so we're ready to submit that to Concom as well. Of course, I mentioned the outreach meeting that we conducted a couple hours ago. We're ready to move forward with alacrity.
Thank you, Mr. Spigot. Does any of the board members have any questions before we go into a motion? Mr. Fazio.
Thank you. So welcome to both of you. And I mean, Bruce, I'm going to have questions of this. I always have questions on this.
Sure.
So I want to start with, it's my understanding that we already have 2 licenses in Grafton from the state. So what does this mean? What does this mean for your business? Or I guess this maybe is a question for the board. It just seems to me, we're having a workshop meeting on this next week, possibility of this potentially changing, but the timeline of this seems a little premature to me. So, and perhaps there's something I'm not understanding. So if we have 2 licenses already in town, what does this mean?
1 second here. Mr. Spinney, did you want to address that?
Sure. So currently there's 2 provisional license holders in town. The provisional license is a far cry from getting an actual store open. It happens to be the first step that you take with the CCC. But as you can see, we've had provisional license holders in town for months, and I have yet to see any architectural review or anybody moving with any real haste. I believe, seeing that you and I sat on the board together, and there's a couple members here that have also been participants in a lot of these hosted community agreements back to their inception. It has always been a race to get to the finish line. The provisional line is a good point where you can see if you have candidates moving forward in any particular direction, but it's a far cry from actually being able to open a store. There is a lot of hurdles, a lot of barriers. There's a lot of capital that needs to be raised and deployed during the provisional license process. I would say most provisional licenses that are out there now will either be bought, traded, sold, moved to a different town, or not even be acted on and fizzle away, so to speak. The small percentage of them continue on moving forward. It takes quite a deal of time and energy to move. That's why when the opportunity was here for us to move forward with this project, we looked at the playing fields currently in town and said, boy, nobody's really moving very quickly at all. We feel that we have good initiative now. We had some good findings come back from our civil engineering, and we have the capital. So you marry those things together, we can move pretty quickly. I would say that we're probably on par with your other 2 candidates that are actively pursuing these licenses currently.
Any other
Thank you.
questions?
Can I just follow up on that, Mr. Chairman? Thank you. Thank you for answering that, Bruce, and that helps clarify a lot of things for me. And actually, one of the reasons, I think one of the biggest reasons we've decided to have a workshop next week regarding this is for something that you mentioned, which is this provisional license doesn't necessarily mean that we have people moving forward. And so we're sitting on, waiting for economic development in town. And have these host agreements with, what we think is going to be, future finances for the community, and they haven't moved forward. So I just didn't know where it was, and I appreciate you answering that question. My second concern has been it's kind of a historic one that I just want to mention to you, which is when you first came forward with this enterprise, there was a lot of pushback on the location. And I understand as a board member how zoning works and the fact that your location is zoned for this business. However, it has been very clear at town meetings and, from public pushback that there's a location, this is not a location that a lot of residents want to see a cannabis enterprise built. And, I am pro-business, I am pro-cannabis business, but I bring this up just because I know it's a concern for some of my constituents, and I just want to address it because it's a reason for me to vote nay. It's to me really the only one at this point, and I just kind of want to put it out for open discussion.
Mr. Prisby.
Okay, well, here's another thing that drives me nuts. When we say we're pro-business, but unless people object to it. Look, you want economic development in Grafton. Not we all, but the town voted for this by a fairly sizable margin way back when. The only question before us here tonight is whether or not we're going to transfer a host community agreement from the name of one entity to the name of another entity, where the entity is the same person, but he's taken on a partner. Now, this is going to be a larger discussion for the 8th, but I will say this. The Commonwealth of Massachusetts did a really terrible job in giving us any guidance whatsoever on how to handle these things. Just a year and a half ago, we were given the instruction that we were to issue host community agreements if we went through a process of just negotiating with the applicant for a percentage of their income plus other fees. And that seemed simple enough. And our approach at the time was we were going to accept every single one that came our way because we were interested in doing this. We were interested in furthering economic development in Grafton. And then it was all going to get sorted out because we had certain zoning that required that, we were really just going to do 2 of these based on this cockamamie calculation about liquor licenses. Okay, so fine. So now we've got 4 of these out there. And they're all quote unquote racing to the finish line, except I don't see anybody racing anywhere. Apparently, we've been treating some of these guys differently than others, and we'll get into that next week. We've had past boards that were very friendly to some applicants, but not very friendly to others. And now here we are, again, sort of questioning, okay, do we really want to vote for this, yes or no? Look, whatever gets these guys to the finish line, Bruce and Alan, if we vote yes and you go ahead and run with this, good for you. If you don't, very soon we're going to be coming to you wondering how is it we can push you across the finish line. Same for the other guys. When we were doing this just a year ago, we were told this was a 9-month process. We all want to do this. And now Grafton is seemingly standing still while Millbury and other communities that surround us are opening facilities. So my question isn't, whether or not I should vote yes on shifting a host community agreement from one name to another. I don't care. What I care about is whether or not we've got 4 entities that are truly invested in opening one of these facilities sometime soon. Because time and again, we've gone through the budget cycle and we keep estimating an amount of money that we're going to get out of a retail establishment, and we keep having to pull it out because as we get closer to the budget, we know it's not accurate. We know it's not reliable. We know that nobody's as close as they said that they were going to be. So if you're telling me now that you think you can push this along, then okay. But at some point, us and you and us and the 3 other applicants have to have a serious conversation because I'm really disconcerted about where we are now in 2020 going into 2021 versus where we said we were going to be just 2 years ago, or just a year and a half ago when we were doing this. So that's my only thing.
Thank you. Mr. Often, and then back to Mr. Fazio, then Mr. Spinney.
Yeah, I just wanted to address the issue of location a little bit. Look, we had a great open deliberative process at town meeting to determine where we were going to allow, the various uses for cannabis. And the town made its vote. It was fairly restrictive. It's not easy to find spots in Grafton. And we do have businesses such as the one that's before us tonight that are investing substantial amounts of money to try to open a business in Grafton. And for me, and if you look at the location where it's actually at, it's, on one of the main corridors in Grafton. It's right next to the Pike. It's not in a, heavy residential area. I think it's really unfair to sort of say no to this on the basis of its location. I just disagree with that. So I guess that's my only comment. I just feel like these guys are, trying to bust their tails to get a business open in Grafton under pretty adverse conditions. And we should be supporting all of our businesses to try to help us realize that economic development that all of us have expressed the desire to have so much. So I guess that's just my perspective on that.
Thank you. And Mr. Fazio, and then Mr. Smith.
Thank you. I appreciate the opinions of my colleagues, and I look forward to the discussion next week too. And I agree with a lot of what both of you are saying. And I asked the question directly to Mr. Spinney as a business owner, because the reality is this has been an issue in the past with a lot of residents in town, and they've been loud about it. And so I'd rather, again, open the conversation and ask the potential business owner, what are your thoughts on this? And my expectation isn't move your location, but this has had some history, and there's going to be potential pushback if you run to the front of the line. And so I just think it's important to talk about. So I'd like to ask Bruce your thoughts on that. Public input meetings, again, I don't know what my suggestions necessarily are. I think it's pretty obvious that I am pro-business, and like I just said, I am pro-cannabis as well. And I think that I speak with the rest of the board that we do want economic development in town. I'm not different from the rest of my board members on that, but I have had people reach out to me saying, I do not want this here. And they have stood and spoken at town meeting about it. And so it is my duty as a board member to bring it up. So I just want to ask Bruce your thoughts on it. Maybe there's no thoughts on it, but it's a concern of mine.
Mr. Spinney, you had your hand up, and there's a question posed to you. And then after that, Mr. Villatoro, and then Ms. Roy. Thank you.
Sure. And, stop me, Alan, if you want to interject on this particular point. The site that we're talking about here, it's office light industrial. It's a derelict building. It's been abandoned for almost a decade now. Part of the reason why we're willing to take the risk to compete with the other people that are in queue, I would be hesitant to say there's a line. We're all kind of in the same kind of general area. I haven't seen, and I pay attention to a lot of this story, any real substantive discussion on a policy outside of the fact that when everybody signed one of these host agreements, they left the room knowing that it was a race to the finish line. I'm completely aware of that. For that particular area, I know you were at my outreach meeting a while back with quite a few people in attendance. We have made a few changes since then. Our outreach meeting a couple hours ago only had 3 people attend to it. I know it may be a sign of the times, but one of the things I expressed there is that once we enter the special permit process, we'll show you exactly what it's going to look like. And some of those neighbors who have voiced their opinion in a vocal way in the past meeting, of course, I was there as well, will be able to come out and say, okay, well, what's this going to look like? What are you going to do for traffic? We're going to run through the standard practices that all other candidates for, whether this is a cannabis outfit or whether we do something else there from a retail perspective. We're going to rebuild the building there. You're going to see a dramatic increase in the appraised value and the home value in the area. You all know living next to abandoned buildings is not very good for your home value. The other thing that Alan and I have considered is to make sure that we blend it with the neighborhood quite well. So one of the things that I mentioned before is that we have some fairly fortuitous civil engineering feedback that we got, how we can position the building, what it can look like. What we're going to try to do is put the parking on the side, have some concealment to it. On the building itself, we're going to use the existing footprints, go 2 stories, make it just like a gabled cape type of appearance with a farmer's porch on the front. It would all be faux, of course, because you're not allowed to have windows that can actually look into the area. And all of the retail experience and exposure will be in the rear of the building. We weren't able to kind of move forward with that particular project site until very recently. So we're going to, have a retail establishment there that's going to have, some traffic impact to it as well. But we're going to mitigate that as best we can.
Yeah, and part of the stringent requirements on behalf of the CCC require us to have certain protocols in place, specifically revolving around diversion, to prevent the sales of goods to minors. A lot of the stigma associated with location seems to stem from the idea that kids are somehow going to get their hands on these, on any kind of consumable goods. And the truth of the matter is that the guidelines for egress in any of these locations is stringent to begin with, and identification is checked at multiple points. But stepping back and even beyond that, really, our goal and our mission with this business is really not to acquire that demographic. As fortuitous as that may be to acquire some from that runoff, our target demographic is certainly, an older demographic that we're going to do our best to ensure that we have a positive image, ensuring that we, stand apart from our competition by providing a product and service that stands apart. And part of that requires that we ensure that we keep our guidelines and our integrity up high.
Thank you. Before we go next to Mr. Fazio, Ms. Roy, you've had a question next.
Yeah, I just wanted to second everything Mr. Often said about harping on the location of this RME. I feel like there are outspoken citizens in town who are just against all of the cannabis locations regardless. And I feel like it's unfair to say that you're pro cannabis, but also against this one because of the location. It just feels unfair to say. And I just wanted to say that.
Thank you. Mr. Fazio?
Yeah, I mean, fair enough. The people I've spoken to are actually in favor of the industrial park, but not in favor of this one, which, brings this NIMBY approach that is exactly what we're talking about. Because I think what's going to happen is if the business opens, and once people get used to a cannabis store in town, and I, for one, am sick and tired of driving by an old dilapidated building on a main road in town, that people will change their minds. I think once they know it's a safe location and their children are not walking from the high school up to, this location, that I think there's fear. I really do. And so people say, well, yeah, on the outskirts of town, it's fine, but it's too close to the school complex. And so I think that is a concern. And I bring it up just as a valid, outspoken concern. And I just want to say that after this discussion, I'm voting in favor of it because I think that guidelines are put in place. And what I would ask is that we continue to have this open conversation, that it sounds like there's going to be additional outreach meetings, because unfortunately to a lot of people, a lot of outspoken people, this is a location that is just not, that some people don't deem appropriate. And so, I will stand behind my vote for the people and explain why I'm voting in favor of it. But it is what it is. I think it's mostly fear-based.
Thank you. I want to wrap this up and just get to the motion at some point. Mr. Hoffman, did you have a question?
Yeah, just quickly, look, a lot of the location-based issues should be dealt with by the planning board. Typically, that's the process that we use to deal with those types of issues. The other thing too is just, we've had several businesses that have opened in surrounding towns now, and as Mr. Villatoro has kind of indicated, businesses are having to really differentiate themselves now. So you can't just open any business. Your consumers now are getting more kind of used to the idea that there's competition and that they can go elsewhere, and they're not just necessarily going to the place that's open a few towns over. So as this business becomes more competitive, all of the locations and facilities that are being built up, they're all getting nicer and nicer. It's just a natural kind of element of competition that happens. And so I think going from, a dilapidated, boarded up building to something that presumably will be really nice, I'm excited for the opportunity. So I hope you guys can move at pace, and I look forward to it.
Thank you. If there's anything else, I think, a lot of the stuff I know we're hashing out already that we have scheduled for next week. But again, we have a consideration tonight, a motion to transfer post-community agreement in front of us. If there isn't any more discussion, I can entertain a motion at this point.
I move the board vote to authorize the town of Grafton to transfer the host community agreement currently held by Noble Manna to Discerned Cannabis Purveyors.
Second.
I have a motion made and second. Any discussion on the motion of the transfer? Seeing none. All those by roll call vote. Ms. Roy?
Roy, aye.
Mr. Frisbee?
Frisbee, aye.
Mr. Fazio?
DeFazio, aye.
Mr. Often?
Often aye.
Peter Carlson, aye. Declare the motion carried. Mr. Spinney, Mr. Villatoro, thank you very much for coming out tonight. I appreciate it. Thanks for your information. Good luck with you guys.
Thank you very much. Good night.
Mr. Chair, I was just a follow-up to what I mentioned earlier, the affidavit that needs to be provided.
Oh, correct.
Is that something that we can do by motion tonight, or how do you want us to proceed with that?
We just took a motion to approve, consider moving it. What more do you need us to vote on tonight? I'm confused.
Well, there's actually, I just want some guidance on who's going to be the agent moving forward with the affidavit. So I know this, the current TA wasn't here for a lot of the process and to do the other ones. There is a letter that that has a couple of things that need to be filled out, and the agent from the town.
Oh, I understand. So
that agent is now.
I got that. Mr. Terenzini, did you want to address that? I think we talked about some of the logistics of that earlier.
Yeah, I'm still, as the temporary town administrator, able to sign that letter, Mr. Chairman.
Thank you.
Okay.
Is that suffice for you guys?
I'll provide it to him tomorrow. Thank you.
Thank you very much.
Thank you very much.
Bye now. Have a good night.
All right, thank you. All right, moving along here. So I know we had a brief discussion about this earlier with regards to annual license renewals. Before we kind of get into the meat of this, I mean, I kind of got a sense of the board. Some of you want to hold off on this. Is that, you want me to table this for, it would be the next meeting on the 15th. Is that what I'm understanding? Okay, so without objection, oh yes, Ms. Roy.
Are we able to? Nothing expires December 1st where they can't serve alcohol or anything, correct?
These licenses run from January 1st through December 31st, so we have until the end of the month to get the paperwork done. Yeah. Okay. Any objections to postponing this to the 15th? Okay, thank you. All right, we'll bring that back. Last but not least on here, we have an action here tonight to authorize the chair to sign Center for Tech and Civic Life grant agreement. Mr. Terenzini, do you want to give some give an overview of what this grant opportunity is for the town clerk's office? You're on mute.
My apologies. This is a opportunity to recoup approximately $7,000 of additional expenses that we incurred in carrying out the fall election. That is the short and simple of it.
Is there any questions on taking up this motion? Mr. Often.
Yeah, there was a stipulation in there that we wouldn't be cutting the budget of the clerk's office within the term of the grant. I didn't actually see in the grant, the actual grant itself, what the term was. I'm not sure.
It's for this fiscal year, Matt.
Okay. So I just wanted to bring that up as, we're making a decision here to not cut somebody's budget. I'm not advocating one way or another, but I just wanted to make a note that that's part of the obligation under the grant.
Essentially, that is to ensure that you aren't using these funds, which are intended for supplemental costs, to supplant tax levy monies that you'd already appropriated.
Yep, it's just a constraint on the town's budgeting process, and I just wanted to bring it up. That's all.
Yep, understood.
Thank you. All right. Any other questions? Comments? Okay, I can entertain a motion.
I move the board vote to authorize the chairman to sign the grant agreement with the Center for Tech and Civic Life in the amount of $7,914.
Motion made and seconded. Any discussion on the motion to sign the grant? Seeing none, all those by roll call, please. Ms. Roy,
Roy, aye.
Mr. Prisby.
Yeah.
Mr. Fazio,
Fazio, aye.
Mr. Often,
Often aye.
Peter Carlson, I declare the motion carried. Thank you very much. So moving up, we don't have any resignations tonight. We do have one select board appointment for Cable Oversight Committee, Ms. Lisa Kelly. If there's any questions, I can entertain a motion for the appointment.
I move the board vote to appoint Lisa Kelly to the Cable Oversight Committee.
To fulfill it, could you read the rest of the motion, because it's a one-year appointment?
I could if I printed that page out, but I didn't. Sorry.
I'll do it. I move the board.
Copy winging it.
I'll move the board vote to appoint Lisa Kelly to the Cable Oversight Committee to fulfill a one-year term set to expire on June 30th, 2021. Do I have a motion?
So moved.
Second.
I have a motion made and seconded. Any discussion on the appointment? Seeing none, all those by roll call, please. Ms. Roy,
Roy, aye.
Mr. Prisby.
Yeah.
Mr. Fazio,
Fazio, aye.
Mr. Often.
Often aye.
Declare the motion carried. Thank you very much. Okay. We don't have any appointments from town administrator. As you can see, we moved a lot of our new business under the schedule because we've had people coming in to present. Do we have any select board member reports? Mr. Roy.
CIPC finished their capital recommendation last night for FY22, and we got that over to Mr. Terenzini this morning, and we're going to start getting to work on our 5-year plan.
All right. Anybody else? Okay. Do we have any town administrator reports, Mr. Terenzini?
Well, Mr. Chairman, as you know, we're working on the report for the solid waste challenge that is before you. And I did circulate a working draft of questions and comments to explore at the workshop next week. I did get a series of comments from one member, and I've been able to include those. If anyone has any other comments, if I could get those within the next day or so I can get them to council, I'd really appreciate it. I think you're going to find it is a very complex, interwoven, challenging issue when you go to dissect this and really separate the course of actions that you have before you. We did interview, or in the process of interviewing, the management analyst, consultant, communication specialist. I've described it as a marriage of within one person of geek and social butterfly. It's a challenge, but that's kind of the we've told the interview team that concentrate on the social butterfly side, and we think we can teach sort of some of the analysis stuff to that person in finance director. So those first round of interviews should be wrapped up this week. And I think we'll have quite a full plate for you next Tuesday night. And I just want to say that when I got Ms. Roy's and her committee's report, my initial reaction was, wow. And then I think I said something about, boy, am I glad this was off my plate. So to Ms. Roy and her group, thank you. Thank you very much for your efforts.
All right, thank you. Any questions from Mr. Terenzini? Yes, Mr. Fazio.
I just, I don't know if this is a question for Mr. Terenzini, but just in general, where are we with the screening committee right now? And what's the timeline or the timeframe for that? I'd just be curious of an update if anyone has one.
I would not.
I can do that for you. So the screening committee, I apologize. I should have done this in updates. Sometimes I forget what I updated since the last time we were here because we've been doing this most weeks. Okay, so since the last time we met, the screening committee, I believe, met the third week of November. We went through, I'm going to get the number wrong. It was, I think, 33, 34 resumes. And whittled it down to a field of 7 or 8. And we had a number of candidates that we were excited about. We planned on coming to the board with at least 7, knowing that one of the candidates was going to be a top contender in another community because that person was interviewing and was a finalist at that other place. And it turned out that they did get the job. So instead of 8, it's down to 7, kind of as expected. It's disappointing, but as expected. The next step is to go through interviews. And when you have 7 people, obviously you want to give them some time. So that's 7 hours worth of time. There's 9 people on the search committee. We're talking about the holiday season. So, again, getting 7 candidates plus 9 people to block off 7 hours worth of time was challenging. And we ended up doing interviews. We're going to do one round starting at 3 p.m. on December 11th on a Friday. We're going to do another round starting at 4 p.m. on the 15th, which is a Tuesday. If it goes over and we have a board meeting, I'm going to be late. And then we have a discussion about who amongst the group we're going to recommend to the town or to the board on the 17th. So that list, so we're going to be coming up on Christmas. By the time the board gets to discuss it, it probably will be the first week in January. So that puts us this board, in a position of talking about it and then making an offer and then going through the acceptance process through January into February. Realistically, we're probably not going to have a candidate hired until the first week of March with that schedule. So that's what we're looking at. But I can tell you, just again, this is a subjective opinion, but I think I can speak for most of the people on the committee. I was really impressed with the resumes. This is a great group. We're going to be well served. So that's where it's at.
Thank you, Mr. Brisby. When you said hire date by March 1st, you mean a start date by March 1st?
Start date. Yeah, sorry about that. That's what I meant.
You had little heart palpitations here on my side. I don't know if you could see it, but thank you. Okay.
My side also, Mr. Chairman.
Yeah. All right. Thank you for that. Any other select board member reports or Dick Shane, I'm sorry. Any more questions on the TA reports? I apologize. All right. We had a couple of correspondence this evening. I know the board had an opportunity to review them. If anyone has any comments or wants to take any action based on them. Mr. Brisby.
Quick thing, something that I think deserves addressing now that we've talked about it a little bit. Mr. Kinch from North Grafton, who notes he's been a resident paying taxes now for over 45 years, is encouraging us to get moving on recreational marijuana sales. Again, I think everybody here wholeheartedly agrees, and I think it can't be said enough that the Board of Selectmen or the Select Board and the town administration can't create business. I mean, we can't make it happen. If we could, then we would have the world's best Italian restaurant, because that's what I'm looking for, as well as any number of things that we all want to see here. The best thing that we can do is create the conditions in which people would want to establish a business here. And part of doing that for us is to try and move along the holders of these host community agreements as best we can. Unfortunately, as I think we're going to discuss next week, we have very few options for doing so. You give someone a host community agreement and they go move along, and they move at the pace that they're going to move at. And I think we're going to explore ideas about how we can be a little bit more proactive about that next week. But to Art, I say, I feel you. We all want the income that we're talking about here. So I respect the letter. I respect your input. Thank you.
All right. Any other questions on the correspondence this evening? Okay, I do have one comment. When people are sending correspondences to us and addressing it to other boards, please note that, TA's office isn't, in this case, there was a snafu with one of the letters from Mr. Yeomans that took a little bit to get to the Historic District Commission. I received a call from Mr. Scarlett, today about that, and they were just, made aware of this. So anyway, long story short, I think anything going forward, if anyone's going to be writing letters to other boards and CCing us, just remind them to make sure that they address it and somehow send it to that board directly to ensure that it gets delivered in a timely manner, and not, just leave it up to people thinking like, oh, they must have gotten a copy and it never getting delivered. But it did get delivered, granted a few days late, but I just wanted you all to be aware of that. All right. Discussion tonight, I put on here was, I didn't know if the board and, wanted to put together a special election for town moderator or how it felt. But I wanted to leave this open to discussion. If anyone has any input or guidance or thoughts, let's talk about it. Ms. Roy.
How much does a special election cost?
So last I heard, it's anywhere from $8,000 to $10,000.
No, thanks.
Okay. Anybody else? Mr. Often?
Yeah, just, is there any impact on appointments? Like what's that process looking like?
Interesting. I went through that, and someone else can fact check this too, by the way. So please just take it for, for what it's worth from me. Keep in mind that the Finance Committee is fully appointed right now through the end of the year, through the end of June. We have an election coming up this May. So, depending if someone steps up to being town moderator, that appointment process would fall to the new town moderator once elected. There is no other appointments from any other boards or committees that the moderator has appointed in the past. I've reached out to, I think, a few committees that has occurred, and there's no need to fill those roles. Mr. Frisbee.
Okay, so the next question is, what's the impact on town meeting in the budget preparation process? Traditionally, Ray was involved with TRICOM meetings, organizing those, getting Springtown meeting ready. I don't know what the COVID situation is going to be like next spring. Fair to say that maybe we'll be in the same position we were in the fall and in this past spring. If that's the case, then we would need someone to at least fill those roles in the springtime. And I can't remember if Ray's appointment in the past fall town meeting carried over at all, or if we would have to appoint someone again temporarily. But there's just a little more that goes into it than just running the meeting.
So because we appointed a deputy town moderator at the semi-annual town meeting, Mr. Mead, he could fulfill the deputy moderator role at the special town meeting that we have during the spring before we have the annual. At the annual, the presiding officer at that time would just ask the town meeting to, reappoint a deputy moderator to fulfill that role for that town meeting, and then so on and so forth. So you only have to do it once per kind of per year when you have your meetings, the way we read it. So at this point, just to let you know, I did talk to Mr. Mead after we had our meeting back in October, and he gladly, I'm sorry, that was November, early in November. And he gladly said that he would fulfill in that role, and if town meeting were to appoint him as deputy again, that he would facilitate town meeting. As for the logistics meeting, he can participate. I'm anticipating that he'll participate like we've done before prior to town meeting, and that he would, just know what the agenda looks like and just what the logistics are, and just kind of go through and do what he's did before. So that's how I've envisioned it. Ed, I'm not sure if anyone has any questions or if there's a concern that they have. We have a few months before we get to that point, so. Any other questions or what their thoughts were on holding a special election?
So if we don't hold a special election, it would the position would be open for candidates to apply for the May election?
Correct.
Okay.
And it would only fill the term for 2 years, if I'm not mistaken. But I can check with Paul Cook, Assistant Town Clerk, on that too. That might be something to validate about how does that work. Mr. Hoffman?
There's somebody's raised their hand. It just seems like we're getting to the end of the conversation, so.
Yep. Does anyone have any objections to letting Ms. Foley back in? Okay.
I raised my hand earlier, but any other responsibilities other than just moderating, not just, but moderating the town meeting now?
Ms. Foley, yeah. So the town moderator has appointment authority within the town charter. And I think there may be some other appointments.
So appointment authority over what?
Finance committee. It's in the town chart. Yeah, all of the, and I think that's really the only appointment authority he had. That the
Thought you changed that. No?
It was proposed for special legislation, but until such an act takes place, that doesn't change.
Okay, great.
Okay. Thank you. All right. Any other questions or comments on that? I'm not hearing that there's a favor of it going forward. So, okay. One second here. All right. We have next up meeting minutes for October 15, 2020.
I move the board vote to approve the October 15, 2020 meeting minutes as presented.
I have a motion. Do I have a second?
Second.
Motion made and seconded. Has anyone had a chance to review these, and just so we know, thoughts?
We always review them before we vote, right?
I do. I just wanted to know. I know last time we had some questions, so I just think it's just, I just want to make sure, we're good. If there was any other questions or concerns, I figured this was the time to bring it up. But if there isn't any discussion or questions, I'll go to a vote.
Maybe just some thanks for, the kind of thorough meetings that we've seen. So it's a lot of work, I'm sure. So I appreciate it.
All right, I agree. All right, any other questions or comments?
These were well done. Thank you.
Great. All right. I know I'm saying thanks, you're welcome, like I did them. No, that was all Ms. Duncan, but thank you to Joanne. All right, if there isn't any other questions or comments, I'll take a vote by roll call. Ms. Roy?
Roy, aye.
Mr. Frisbee?
Frisbee, aye.
Ms. DeFazio?
Fazio, aye.
Mr. Often?
Often aye.
Peter Carlson, aye. Further motion carried. Thank you. We have November 17th minutes.
I move the board vote to approve the November 17, 2020 meeting minutes as presented.
Second.
Motion made second. Any discussion on the motion? Seeing none. All those by roll call, please. Ms. Roy?
Roy, aye.
Mr. Frisbee?
Frisbee, aye.
Mr. Fazio?
Fazio, aye.
Mr. Often?
Often aye.
Peter Carlson, I declare motion carried. Thank you. So I have a couple of ongoing tasks here for just review, just for informational purposes. library building project update. So I know we had Mr. Duchesne, but is there any questions or anything that we need to bring forward at the next meeting for this? We can leave this here if you all feel it's necessary. Thoughts, concerns, questions, comments? Mr. Alston?
Yeah, I thought we agreed to put the trash and recycling on this, just as a reminder in our meetings. So I know we got an update, but it's something that I feel like because of the complexity and the potential financial liability and community outreach is like, it's going to be one of the things, significant things we're going to deal with this year. So I do think it should just be a standing item.
Okay, yeah, we'll make sure that's in there. My bad. Any other questions or comments? Okay. Well, I want to thank everyone for tonight. Just to let you know that you see Mr. Terenzini's memo from the town departments are included in the packet. If there isn't anything else, I can entertain a motion to adjourn.
I just had a quick question that was brought up earlier with the Board of Health. The email that they received this afternoon, were we going to get a copy of that at all? Do we know? Was that determined? Were the Board of Health going to send it to us, or was?
We will forward it to you you have, I believe, 2 more applicants for the 15th. So we will forward that with that additional packet material.
Yeah, I mean, just on that end, that's good information to have for us as we head into the 15th, because, that's another discussion we're going to have as time goes on here. And it was touched upon a little bit tonight, and it was unfortunate that Karen couldn't be here. And I understand she had a work commitment. But, at some point we need to talk about enforcement. It's all well and good to assume that everybody in the community is going to cooperate in good faith, but that information is going to be good to have for us going into the 15th, I think.
Okay. All right. Thank you, Mr. Terenzini. Any other? If not, I can take a motion to adjourn.
So moved.
Second.
Motion made and second to adjourn. All those by roll call, please. Ms. Roy?
Roy, aye.
Mr. Frisbee?
Frisbee, aye.
Mr. Fazio?
Fazio, aye.
Mr. Alston?
After night.
Carlson, aye. All right. Meeting's adjourned. Thank you very much, everyone, for coming out, and we'll see you next week.